Hello, my name is Dr. Orson Morrison, and today I'm going to be talking with you about mindfully coping with the stress and the anxiety associated with living through a pandemic such as COVID-19. As you can imagine, most of my work in recent days has begun to shift to really helping support kids and families who are struggling with the stress and anxiety associated with living through the current pandemic. And so I thought it would be useful to pull together some of the resources, some of the literature out there on how to effectively cope. How do we get through this challenging and uncertain time? So a little bit about my background. I'm a licensed clinical psychologist in Illinois. I'm the director of DePaul Family and Community Services. It's a community mental health center at DePaul University, and we're mostly a child and family clinic. We provide individual therapy, family therapy, psychological testing, as well as early childhood services such as parent-child interaction therapy. We also have a number of school partnerships where we provide services in school-based settings. And if you have any particular need to get more information about our clinic, feel free to go to our website at fcs.depaul.edu. So this particular community talk is funded through the Mindful Middle Schoolers program, and this is a partnership between DePaul University, the Oak Park Township Community Mental Health Board, and Oak Park's local district 97, the elementary school district here in Oak Park, Illinois. And the project is really focused on supporting kids who are struggling with issues like anxiety, depression, executive functioning challenges. We are offering community talks on these mental health topics. In addition, mental health and technology, mindfulness-based approaches, and basically understanding the social and emotional needs of youth. We're also providing school-based supports in the form of mindfulness groups and individual and family therapy. Now, in light of the recent quarantine or shelter-in-place orders, we have temporarily suspended our in-person work and are in the process of moving much of our services as possible to online platforms, telehealth. If you have any questions about our program, please reach out to me directly at my email or contact your school principal if you are a family member at Julian or Brooks Middle School here in Oak Park. So today I'm going to talk with you about a number of different things. We'll just review briefly what a pandemic is, and then we'll look at the different factors which often play into our stress and our anxiety related to living through a pandemic. And then we'll focus on some of the strategies that you might use in order to effectively cope during this time. At the end of the presentation, I'm going to lead you through a mindfulness-based activity which might be helpful in managing some of the stress and anxiety you might be currently feeling. So let's first cover what a pandemic is. Pandemics occur when there's a new virus in the community. And because it's a new virus, human beings don't necessarily have the immunity in their bodies to protect or defend against that new virus. These viruses in pandemic situations are very easily transmitted from person to person, and this is why we often see a rapid increase in the number of cases, because this virus has the ability to quickly transfer from person to person. And because we don't yet have the immunity to the virus, it makes certain populations, particularly those with underlying medical conditions or the elderly, particularly vulnerable to getting very, very, very sick. for more information about pandemics, definitely go to websites like the Centers for Disease Control and Prevention or the World Health Organization, or you may have a public health department in your local municipality that you can turn to get more information about pandemics, COVID-19 in particular, what you can do to prevent the transmission, when to seek medical care, etc. So much of the public health response to pandemics such as COVID-19 has really involved strategies such as social distancing, quarantines, restricted movement, and the specific strategies, of course, have varied from municipality to municipality, or from region to region, or from country to country. So you definitely want to check in with your local public health entity to see what specific strategies are in place for you. But in terms of the emotional reaction or the emotional response to these sorts of strategies, really this can vary depending upon whether or not the orders are voluntary or mandated. So psychologically, we obviously feel much more stress when we are mandated to do something. When somebody is mandating that we stay in our homes versus a voluntary order where we are recommended to stay home, but we can still move about in the community for essential purposes, right? So mandated versus voluntary can feel very different. There is some evidence to suggest that the longer a quarantine goes on, the more impact that has on our psychological well-being or our levels of stress. And we do know that after a quarantine is over, or after an pandemic is over, we may still see lingering symptoms of stress and anxiety and avoidance behaviors, even if that pandemic is over. And this seems to be related to how long the quarantine or the pandemic has lasted. So the longer it lasts, the more likely the symptoms are to persist after returning to baseline. So human beings are definitely creatures of habit, right? We like routine. We have a daily routine in terms of getting up in the morning, preparing for school, preparing for work. And many of us are really having a lot of struggles around, adjusting our routines completely to really address the orders for social distancing and sheltering at home. So we definitely are social beings, and we need regular social contact. And kids and adults need that social in-person contact. And so we're having to kind of modify our connections to one another. We're also having to rely very heavily on technology in order to get those social needs met, and also to get things done like learning, schoolwork, as well as many of us have now transitioned to remote work. Changes in routine related to isolation and confinement may result in individuals starting to feel disconnected, unproductive, bored, frustrated. These are very, very common emotional reactions. As we've seen these public health directives for social distancing and sheltering in place, we have seen people really driven by fear to really stock up. And so it's not uncommon now to go into a grocery store, for instance, and see that the shelves are bare. And that creates an enormous amount of stress, right? So we start to panic, we start to worry, are the supply chains, the food supply chains impacted? Are we going to have the basic things that we need in order to get through this, particularly if it's a lengthy period of time? Similarly, with regards to medical supplies and medical systems, we've seen in some parts of the country and the world access to medical supplies such as masks, testing kits, protective gear, disinfectant materials, all of those things. We've seen supplies dwindle as people kind of begin to purchase all of these items and kind of hoard them for themselves. So it's really, really important that we really be mindful of taking what we need and not letting necessarily our fears overwhelm our decision making on these things. We might also experience anxiety related to possibly being a carrier of the virus. So if we're having any symptoms associated with the pandemic virus, we may start to be really stressed about that, even if we don't know if we have it or not. We worry that we might infect family members who maybe have underlying medical conditions or who are medically compromised. We also might experience a lot of anxiety ourselves if we are somebody that has an underlying health vulnerability, such as diabetes or asthma. And then we might start to worry also about access to routine and emergency health care and prescriptions, particularly if our healthcare system does become overloaded with responding to individuals who are really sick with this virus. Financial stress is certainly a major focus right now for a lot of the adults that I'm working with. Parents, adults are worried about loss of work or income related to maybe owning a business or not being able to work in jobs that require in-person service. We are also seeing a lot of stress, particularly from lower socioeconomic groups, families that maybe who are living in poverty or who are not typically making a lot of money, who don't have savings, for instance, to get them through this difficult time. Those that are self-employed or salaried staff who might be unable to use paid leave options. Some strategies for mitigating the stress associated with financial stress would involve things like flexible work arrangements or financial safety net programs. Governments may step in and defer tax payments or may provide businesses with loans to kind of get them through difficult times. So again, check with your local municipality or government system to see what might be available to help during this time. Previous vulnerabilities and protective factors. So I've mentioned this already with regards to medical vulnerabilities, but how one responds to anxiety related to pandemic may also be really impacted by what we previously bring to the table in regard to a number of different things. These might include cultural factors, histories of being oppressed, marginalized, as well as your cultural resilience and strengths, right? So we bring all of that to the table in how we might cope with a stressor like a pandemic issue. Previous mental health history. So if you were somebody that already struggled with anxiety and depression, adding on the stress associated with a pandemic may make things worse, may exacerbate those previous mental health conditions. Issues like trauma, pandemic situations can feel incredibly traumatic and can trigger previous trauma responses in those that have a history of experiencing trauma. Health status, we've talked a little bit about this already, but if you come to the table with previous pre-existing health conditions like diabetes and asthma, those may make you more vulnerable to having a serious reaction should you become infected. Disability or ability. So, of course, we've all been told to socially distance and to isolate, but for some individuals, like those that struggle with disabilities, physical disabilities, or even emotional disabilities, they rely on other people. They rely on in-person support often to get a lot of their needs met. And so they do not have the control or the ability to limit themselves socially. And that can cause significant anxiety. I've also talked about socioeconomic status, so not having savings, not having regular income coming in. Folks that are living in poverty are particularly impacted in terms of anxiety and stress responses. So access to information is really, really crucial during times of pandemic. There's a lot of uncertainty, and situations are often changing quite rapidly. So your stress can be intensified if you're getting mixed information or mixed messages or confusing information from public health officials or government bodies, or if resources are not readily available at your grocery store or at your drugstore, or if critical information about what's going on is being withheld. So that can all really, really create a lot of anxiety. So in general, we want information to be accurate. We want it to be like from a credible source. We want it to be timely, so we want to hear about important information as it happens. And we want the information to be communicated effectively, clearly, simply, in a way that's accessible to us. Stigma is another issue. We've seen during this time of pandemic, certain populations may be experiencing stigma from the general population. So sometimes there's stigma against healthcare workers. So those that are working in hospital settings, for instance, in ERs, etc., there may be a perception of those around them that they may be vulnerable, they may be contagious, they may have picked up the virus, and so we may, even unconsciously, stay away or treat healthcare workers differently. Those that are infected, of course, will be subject to quarantine, and so, but we may treat them differently because they are infected. And then we've also seen some situations where certain populations, like those of Asian descent, being blatantly discriminated against because of the fact that this particular virus, COVID-19, originated on mainland China. And so we've seen some really, really disturbing incidents of discrimination occurring to those of Asian descent. So we definitely want to be mindful of how are we approaching different people. Of course, we want to take precautions, like if you're a healthcare worker, etc., or you're interacting with a healthcare worker, but we should be very mindful about how we're treating one another during this time. So adult-child relationships are really, really important when we talk about anxiety, particularly in supporting the anxiety of kids. And so modeling is very important. So kids are looking to us as adults, how we manage our own anxieties and fears can impact how they experience their own anxiety and fears. If we're using very catastrophizing language, that's going to, of course, inflame their anxieties. If we are becoming more and more controlling of children's behaviors and routines, that can also lead to increased stress. Now, of course, during a pandemic, we are going to change our basic framework, our basic boundaries, and basic structure, but we should, after we've sort of established what that new structure is going to be, we should try and give kids developmentally appropriate options for making decisions, for using their time in certain ways, so that they don't feel like, oh my gosh, everything, I have no control anymore. We also want to make sure that we are approaching each other, approaching our kids, our colleagues, our family members with a lot of compassion, positivity, and acceptance. The biggest takeaway with regards to anxiety and stress is that most of us show anxiety and stress in so many different ways. So there's really not one symptom or one way of demonstrating if we're anxious or stressed. We want to be looking for things, though, around our recurrent fears, worries, sleep difficulties, trouble relaxing. We may see difficulty separating from parents, not wanting to go outside of the house, not wanting to go into the backyard alone, not wanting to go to bed alone, irritability, tantrums. All of these things are quite common during times of pandemic situations. Let's talk a little bit about some of the age and developmental considerations. So with children, regression is quite common. So difficulty sleeping, not wanting to be alone, particularly for younger children, there's likely going to be some increased dependence on adults, or wanting to be near, wanting to be close to mom or dad, needing them more, wanting more help from them. Tantrums, aggression, irritability. Young kids often need a lot of very concrete, simple communications around what's happening and what's expected. For middle school aged and high school aged children, definitely you can see anxiety, persistent worries, and sadness about what's happening. They may need additional information compared to really young kids. They want to know what's going on. They may have questions about what's going on locally, nationally, internationally related to these issues. I often recommend that parents start with, inquiring about what the child knows, so starting there and then having conversations that are primarily led by the sorts of questions that children might have about the issue. Kids may have difficulty concentrating. I know that we're transitioning mostly to online learning modalities, and it can be hard to concentrate and to focus while also thinking about what's going on in our communities related to the pandemic. For older teens, there may be this this invincible sort of spirit, this resistant spirit. I'm not going to listen to my parents or to the government who is telling me to not go out and socialize. So you may see some of that, but it's really, really important to educate and explain to your older kids the consequences of going out and resisting those public health directives, because they may be contributing to the community spread of the virus. And adults, of course, also are experiencing a lot of anxiety, worry, sadness. There's financial stress. There's the stress associated with, you know, if you're fortunate to do so, moving your work remotely to home, interacting, you know, with your colleagues online, when there's dogs and kids and all of these other things in the background. This can be very, very, very stressful. We're also trying to help our kids, you know, get set up in technology and homeschooling. This is really, really a stressful time. And then, of course, older adults, the restrictions and the need to socially isolate are even more important for older adults because of their compromised health status, and you know, in many cases. And so this may limit their ability to connect with their children, their grandchildren, and so they may need much more frequent phone and you know, video check-ins when possible, just to keep that social connection going with loved ones. So with regards to problematic coping, we might see situations or symptoms like passivity or avoidance. And of course, we're all avoiding during this time of pandemic. So when I say avoidance, I'm talking about avoidance beyond what is the recommended public health strategy. We may see anger, irritability, substance use, you know, for adults, for teens, you know, using substances to cope with the stress that we're feeling, under or overeating, in extreme cases, self-harm, extreme hopelessness, you know, kind of that catastrophic thinking, we're all going to die, you know. So those are some, in extreme cases, the problematic coping symptoms that we may see. So let's transition to strategy. So how do we cope? So communication, you know, parents, teachers, and other adults, obviously continuing to talk with your children to recognize the signs and symptoms of problematic anxiety and depression, teaching kids about what's going on in terms of the pandemic that we're currently going through. Take time to listen. I know that we're all trying to kind of manage and control and plan as much as we can as adults, but let's step back a little bit and allow kids to talk, to ask questions, to express what they're feeling, and validate that. So yes, it is common to experience anxiety and stress. You know, provide that mirroring and that validation for what you're hearing your particular child struggling with. So the issue of control, obviously there's greater restrictions on all of us, and so that will obviously trickle down to the way that we parent our children. We want to just be mindful that when we establish what's the new normal, what are the new boundaries and limitations, that we try to think about, well, what are the areas that my child still does have some control, some ability to make their own decisions, to control the way that their day looks, etc. That will definitely help them manage their stress and anxiety. Of course, you need to do this in developmentally appropriate ways. So the really young kids, you know, you're going to be giving them a lot more directives and structure than the older teens who are going to be subject to the same sort of public health restrictions that we're all under, but how can they make decisions about maybe trying new things while they're at home, or taking healthy risks or safe risks while they are under quarantine. So the media use, social media use, this is a a topic that we talk about a lot these days with regards to youth mental health issues. So this is not meant to be a comprehensive presentation on technology and mental health in youth, but these are some things that I think would be important to think about related to a pandemic. So some of the benefits of social media during a pandemic time is that it does help actually kids keep those social connections going. It can be a source of social support instead of that in-person connection. It can also help kids and adults, for that matter, stay connected, not just locally with our neighbors and our immediate friends and colleagues, but also connects us to a larger global community. And then social media, you can often get real-time information. So during this time we need real-time information about what's changing, what is the latest public health update or directive. And so these are some of the benefits of using social media during this time. However, there are definitely concerns and challenges. So if we're on social media a lot, this can really create a heightened sense of anxiety and fear. So if we're checking our social media, every hour and spending, 15 to 20 minutes on our social media every hour, that is just way too much. That's going to create a perpetual state of anxiety and fear in us. So maybe setting some limits around, okay, I'm going to check my social media in the morning and maybe in the afternoon and maybe before I go to bed. Just so you're kind of staying informed, you're getting the information you need, but you're also giving your brain and body some time and some distance away from those really fear-inducing messages. Our brains really do need that downtime away from screens. And so as much as possible, step outside, get some fresh air, do some more tactile, some more hands-on strategies to give your mind and your brains and your bodies some downtime away from screens. And of course, social media is related to a lot of stress and anxiety and pressures to post, pressures to curate yourself or your profile in a certain way. So that can also lead to stress and anxiety. So the takeaway here is that it may have some benefits, but you definitely want to have some controls and some limitations on it so that it's not something you're on or your child's on throughout the day. Anxiety and stress is just such a physical condition. During times of stress, we often experience muscle tension, headaches, stomach aches. It's a very body-based condition, and so we want to make sure that we are prioritizing our physical health as much as possible. We need to have regular sleep routines. We need to be practicing routine sleep hygiene, not bringing screens to bed, generally going to bed at the same times, waking up at the same times, moving to home-based remote work and school modalities. It can really be easy to fall into a disrupted sleep schedule. So kids are wanting to stay up late, they're wanting to sleep in later, but generally, as much as we can, try and establish regular routines. We also want to make sure that we're eating healthy. There is this, with stress and anxiety, some people eat more or eat less, and so it's important to just stay healthy in terms of your nutritional intake. Physical activity, at least at this point, we're allowed to continue to go outside. Of course, maintaining distance from other non-immediate family members. So, but yeah, go outside, shoot the basketball, go for a bike ride, get outside as much as you can, get some fresh air. It can really, really do a lot for our stress and anxiety. Rituals and routines. So we want to establish, with regards to e-learning and continuing our child's schooling, for instance, we want to generally have a schedule of what that's going to look like. So we're going to check in online by a certain time. We're going to begin, certain subjects. Generally come up with a schedule that works for you and your family members. Incorporate breaks, incorporate time away from screens, time for stretching, moving, time for social connections, time for snacks and meals. But if you maybe create, have a family meeting, sit down and decide what is our schedule going to look like throughout the week. Of course, you don't want to be too rigid about it, but I think generally having a framework, maybe posting it on the fridge, can really help everybody, kind of feel like life is continuing. We're going to kind of continue to do as much as we normally did before the pandemic. Having family meals together, going for walks at a certain time in the evening, family meetings. Maybe checking in once a week. How are we doing with this home-based life? What's working? What's not working? What do we want to do? What sort of activities do we want to do together as a family? How do we address boredom? Maybe coming up with a list of things that would be helpful for members of your family to do individually or together if you're feeling bored. And then, figuring out how to continue some of the activities that you had going on before the shelter-in-place order. So maybe you belonged to a spiritual community or a congregation. So how do you stay connected virtually? How do you still incorporate those practices into your daily life? I think those are really, really important to continue as well. I included this picture here of the daffodils popping up in the yard because focusing on the sort of the natural rhythm of things that are seasons, the changing seasons, for instance, that can be really, really reassuring. There are aspects of our lives that have changed significantly, but a lot is continuing on, right? So we're about to enter spring here in the Midwest, and so we're noticing the temperatures getting warmer, we're noticing the bulbs peeking out of the ground. Those small things can really feel reassuring, so make sure you're paying attention to those things as well. So there's a strategy that is based on a model by Marsha Linehan. She developed a treatment model called dialectical behavior therapy. And in this model, she talks about the balance between acceptance and change. And I think this is really, really helpful when we think about coping with stress and anxiety during a pandemic. Because there are things associated with the pandemic that we really need to accept. We don't have control over certain things. And then there are things on the change side that, we do need to change, or we do need to implement, or we do have areas where we can control and problem solve. So I think it's a really, really helpful model to think about. On the acceptance side, this is a really uncertain time, right? We need to accept that this is a novel virus that is spreading through our communities. We don't We don't have control over what that virus is or how it spreads, but we do have the ability to reduce the spread, the community spread, by socially isolating, by socially distancing, right? We also need to accept that there are certain emotional reactions that are quite common in these situations. So rather than resisting those emotional reactions, validate them, accept them. It is an uncertain time. It does feel scary. It does feel like we don't have control. Accept the fact that despite all that, we still have a life that's worth living, that's meaningful. We do still have family and friends, and many of us still have work and school that we can hold on to. Letting go of the emotional resistance can help reduce the intense feeling of stress or suffering that we might be feeling during this time. On the change side, there's a lot of planning, right? So we're trying to figure out our new schedules, our new routines, how are we going to manage the food supplies that we have, what do we need, how can we improve self-care during this time. We're trying new things in terms of technology. All of these things are generally things that we have some level of control over, right? So focusing on both, accepting what's going on, and then changing what we can. In the middle, there's that sweet spot. We need to be doing both. Another strategy is called cognitive restructuring. So if we're noticing ourselves falling into this sort of very black or white, catastrophic thinking, let's say we're having this thought, we're all going to die, putting that thought on trial, right? So we're going to try and get all the evidence we can for or against that statement. And by going to websites like the World Health Organization or the CDC, we can get accurate information about this virus, right? And it may help us have a little bit more of a balanced view about the situation, right? So put your thoughts on trial if you're noticing, particularly if you're having those really, really extreme catastrophic thoughts. So exposure-based strategies, these are more useful, I think, following a quarantine. So once the pandemic has died down and quarantine is over, and particularly if we're noticing those lingering symptoms of avoidance. So let's say we're once this is all over, we're avoiding going into public transportation systems. We may want to use strategies such as exposure-based CBT, for instance, by creating a fear hierarchy. The end goal is to get back to traveling on the public transportation system without too much anxiety. And so in order to get there, we're going to kind of break it down into very, very small, discrete steps. Creating a list of steps, maybe from just imagining ourselves doing a certain behavior, to maybe eventually, doing part of the behavior, and eventually getting back to fully engaging in a particular situation. This often does require some assistance with a professional, but I did want to just kind of mention this as a strategy to help you think about sort of the your post-coping strategies for once this is all over. The other strategy I really want us to think about is altruism. And so we need to be mindful that of the community benefits of social distancing. And I think this is particularly relevant for those, we're hearing a lot of media stories on young people, like avoiding the public health directives to socially distance, etc. Comes from that place of being invincible and being more self-focused. But we really need to all be very mindful about the community benefits of social distancing. And I think that can also help reduce the stress or anxiety we might feel about having to quarantine and socially distances. We're doing this for the good of our entire community and our entire world, for that matter. There's a concept called UBUNTU, which is a term in the Bantu language. It's an African language, and the meaning of Ubuntu is very similar to that of altruism. Archbishop Desmond Tutu from South Africa frequently uses the term, and essentially it means that our individual existence as a human is very, very deeply connected to other people's humanity, right? Our individual actions greatly impact all human beings. We're all connected in some way. So I really liked this concept, and I thought I would include it in the presentation because it does help us and reminds us of how deeply connected we all are, and how connected our individual behaviors are to how we kind of get through this pandemic together. So it's really, really important to not let our individual needs or our individual emotions kind of get in the way of what's in the best interest of our entire community. All right, so lastly, I'm going to walk you through a strategy called mindfulness. And for those that don't know about mindfulness, mindfulness is really about being intentional, being aware of what's going on in the present moment without a lot of judgment. And we're constantly in this mode of doing, of reacting, and of judging. And really, mindfulness is about just observing what's going on in any given moment, and observing this moment as it is, whatever that may be. And so I'm going to lead you through a mindfulness activity now. What I want you to do is to sit in a very comfortable and intentional posture. And if you feel comfortable, just close your eyes. And I just invite you to sit comfortably and to gently shift your attention and your focus to the here and now the best you can. Our minds wander, and that's what our mind does, and so we just sort of have to accept that. But gently shift your focus to the here and now. And we're going to think a little bit about this concept of UBUNTU, which I just talked to you about. But just gently become aware of your ancestors, for instance, of all the many people that have come before us. Think about all the wisdom, all the resilience of people and of populations all around the world that have come before us. think of how we are connected to those people that have come before us, right? Many of our ancestors have experienced very, very challenging things, wars, other pandemics, slavery, oppression. And yet we are here in this moment. And so there's definitely something there that that speaks to resilience, that speaks to interconnectedness. And so I want us to really just hold our attention there for a moment. Think about the wisdom and the resilience of our ancestors. It may help to actually visualize specific loved ones, family members, friends, colleagues. And these can be people that are currently living, or that have passed on, or people that you know who are living in other parts of the world. And just take a moment and think about all the many people in our personal lives that we're connected to. This could be our friends. You know, if you're a child, you think about your friend down the block, or your teacher at school. And just think how deeply connected we are all to each other. And just take a few slow, deep breaths. And gently shifting your focus and your attention to your breathing. Becoming aware of the thoughts that you might be having right now. You may notice thoughts zipping by, or thoughts moving by quite slowly. There's no right or wrong, you're just observing what's happening in your body at this moment. And then gradually shift your attention and your focus to your emotions. What are you feeling? And remember, we're doing this non-judgmentally, right? So we're accepting whatever comes up. We could be sitting with one emotion, or many, many different types of emotions, conflicting emotions. Whatever it is, it's okay. Just observe it. Just notice what's happening for you. And then gently, the best you can, I invite you to shift your focus to your body. So what is your body feeling? Do you notice any areas of tension or discomfort? Feel free to adjust your body if you notice any areas of discomfort, if you want to get more comfortable. What are your feet feel like on the ground? What does your back feel like resting on the chair? What is your body telling you that you need in this moment? And now let's gently shift our attention back to our breathing. But we're going to use our heart as an anchoring spot. So gently shift your attention to your heart. You may put a hand over your heart to help you focus it there. And then take some slow, deep breaths in and out. Notice how your heart beats. Remembering that our heartbeat has been with us for our entire lives up until this point. And then gradually expand your awareness back out into your body, noticing what your body's feeling like in this moment. Maybe noticing what your skin feels like, what temperature your skin feels like. Maybe how your clothes feel on your body. And then gradually let that attention even go beyond your body, out into the room that you're in. Maybe noticing sounds or smells. Just allow your attention to keep expanding outward. Even outside of the building you're in, maybe noticing the level of light or the sun outside, any sounds outside. Thinking about your communities, your neighborhoods, the people you know. And just continue to allow your awareness to expand even further, even beyond your little town or neighborhood. Gradually expand your awareness to your city or your state or province or region, your country. Thinking about people all around the world who are working together to address this pandemic. And when you're ready, just come back to the room, but allow yourself to hold on to that sense of awareness and that sense of intentionality. and use that awareness. I think this is really what a strategy like mindfulness is how do we use this awareness of the present moment to effectively make decisions about what we need to do today to cope, to get through, to plan during a time like the one that we're currently in. And so I hope that this has been helpful for you to review some strategies that may or may not be helpful for you, but I'm hoping that everybody will walk away with at least one strategy that will be useful for them. And I want to just quickly go over when to seek professional help. If there's serious impairment, significant impairment in functioning, whether it be ability to keep doing schoolwork or keep working, or your relationships are deteriorating, if you're not eating or sleeping, poor hygiene, and if a lot of these issues continue to persist after the pandemic is over, those are situations where you may want to consider reaching out to a professional. If you're a parent and you're concerned about your child, sit down and talk with your child about what they feel they may be needing and involve them in that decision making, particularly if they're an older child or older teen. Here in the Oak Park area, you can definitely go to websites such as the healthconnectionhub.org to seek out resources. You also want to reach out to pediatricians or primary care doctors and ask them about resources that might be out there. Many providers during this time have increased the amount of telehealth support that they are providing, so there are resources out there. You can also use strategies such as the texting line for District 97 students. You can text HOPE to 844-670-5838, and you will be connected to a mental health professional who can help navigate that particular emotional situation you may be going through. So with that, I'm going to end, and I included some of the resources and references of literature that I used in preparing for this community talk. So please feel free to go to these websites or these articles if you want more information. And if you could, please take a very, very brief survey indicating what you got out of the presentation, or if you have any suggestions for improving the presentation in the future. I would greatly appreciate it. So with that, I will end. I hope that everybody stays safe and stays well during this time. Thank you so much.